perfect. All right. Can we switch to the other slide first, the Zeo? So I took a different approach to aesthetic medicine, as mentioned. I'm actually a respirologist in terms by trade, and so it's kind of a weird way for me to get into aesthetics. And the way I got into aesthetics was actually through I'm a sleep specialist as well. So I got actually board certified in obesity medicine, and my first device was actually a Zeo. And what I truly wanted was actually body contouring. And so some of the reps were kind of teaching me on lasers and whatnot, and trying to figure out how you get your foot in the door. And so what I learned very quickly was that you have to cast your net very large. So you want to get a large population in. Those are your baseline. So hence, I started with the Zeo. And from then on, I progressed to a full aesthetic practice. We have every machine you can think of. We can do anything. And we also do injectables. And so as you start out, you start to learn about the laser physics and how you start to do rejuvenation and how do you combine therapies. And, in Guelph, where I practice, there's 6 different aesthetic practices on the same street within about 1 kilometer, 2 kilometer distance, right? And some of them are plastic surgeons, and you really have to stand out somehow. And so it's the way you complement your services and combine your services to achieve the best results. And that's what I've learned very quickly how to do. So I want you to just kind of go over some of the things that I do, some of the devices I use very early into my practice here. So I've been doing this for about 4 to 5 years, and so hopefully this will be very interesting for you guys. This is one of the best devices that I've ever come across. I do a lot of lasers, speaking engagements, and it's a multi-platform, and it's a true multi-platform device. And like I said earlier, you truly want to cast your net as large as possible, get all the indications in, get your group a base of patients, and they really migrate through the aesthetic pyramid to higher, more specialized treatments. So you're talking about like microneedling RF, you're talking about body contouring. So these are high return investments. You may be selling 1, 3 per month, right? But the bang for your buck is massive, right? But as physicians, and who's physicians here? Anybody physicians or a few physicians? We tend to delegate a lot, right? And so you want to make sure that all the devices that you do are delegatable. I do all my high-risk procedures, like CO2 lasers, the injectables and everything. So those are the things that I kind of look for when I look for a new device. So it has to be very versatile, delegatable, high return investments, and casting a big net. Oh, sorry, this way. All right. So as I mentioned, the aesthetic pyramid here, a lot of patients come into the aesthetic world wanting injections, right? The neuromodulators, cosmeceuticals, laser hair removal, and then you start to move your way up the pyramid. So these are our gateway procedures. So when you think about laser devices or devices in general, there are gateway laser devices as well, right? These are your laser hair removals, your pigment treatments, your laser genesis or 1064 devices. So as you go up the pyramid, you do more higher end devices like the Secret RF or microneedling with radio frequency, and then you do body contouring as well. So the nice thing about the Zeo is that it's both a laser and an IPL system in one. And so you can imagine of all the indications that you can capture. So actually, it's able to treat more than 20 indications. So it's a really good device. You can actually pretty much have a whole aesthetic practice with one device. Not only you can treat pigments, rejuvenation, you have a semi-ablative handpieces that you can actually tag on to this device. The market for light-based therapy is massive. There's more than 4 million done per year. And of those, Zeo can do 92% of them. Although, mostly they're going to be pigments, they're going to be rejuvenation, laser hair removal. So what does the technology look like for the Zeo? So it's a multi-engine, multi-platform. It's a modular device as well. And the core of the device is actually the 1064 YAG laser. And this is where Cutera really came into the market around 20 years ago. They pioneered the 1064, and it's their core centerpiece because a lot of the therapies we do are based on the 1064. This is the long pulse, so be careful when you buy these 1064. They're short pulses, long pulses. They do definitely different things. Not only do we have a laser, we actually have light-based therapy, which is the IPL system. And so because you combine these two, you get over 20 indications. So these are all the devices you can actually tag on to the base Zio platform. Now it comes with the 1064, like I say, it's the core. Most of the procedures are done with the 1064, then you add it on. The nice thing about the Zio is that you can actually combine the therapies. One of the modalities that the Zio offers is what we call the 3D. And so basically you work from the deep dermis to epidermis in terms of rejuvenations, right? So some of these devices will allow us to do that. So for example, the 1064 is more dermal with the long pulse. They also have the ProWave, which is actually your laser hair removal for people with Fitzpatrick 1 to 3, maybe 4. And then for Fitzpatrick, 4 to 6 or 5 to 6, use the 1064. So it's almost like your specialized laser hair removal devices that has a Alexandrite plus the 1064. But you have this multi-platform device that can do other things just besides laser hair removal. It has the IPL system, and they call it the Limelight, and so a global rejuvenation for the epidermis, for pigments, reds, and even vessels as well. The beauty with the Zio is that it can actually also do a semi-ablative procedures as well. So it has fractional laser, so with the Pearl and Pearl Fusion, for these two combined, that's what they call a perfusion, you can get epidermal resurfacing and also deep rejuvenation at the same time. And the Titan is a deep dermal remodeling, heating for a contraction. So you can combine all these therapies into one. So what I also do sometimes is I do PRP as well. So I take their 3D and add in my PRP at the end, although it's a longer procedure. Overall, it takes about an hour or so. So I call it 4D. So not only just a rejuvenation, you add in the PRP to enhance rejuvenation as well. The Zio, YAG, the 1064, as I mentioned, this is the core of the Zio. It has low melanin absorption, moderate water absorption, moderate blood absorption, and it penetrates deep because it's a long pulse. That's why it's so versatile, right? It's kind of in between everything, and it's safe for all Fitzpatrick from 1 to 6 as well. So with the YAG, you can treat vessels, you treat pigments, you do rejuvenation as well. So all those, and it's safe for all skin types. When we combine it with the ProWave, as I mentioned, you can treat laser hair removal in all Fitzpatrick colors. So the 1064 for your darker skin, the ProWave for your lighter skin. Here's some examples. These are not mine examples, so these are just examples of laser hair removal. Comfortable. The 1064 has actually a copper-cooled contact, so in terms of consumables, the only consumable is really your gel that you're using. And that's one of the beauty when you look for a device, you look for consumables, right? And there's virtually no consumables with the Zio. All you're really using is sometimes topical anesthetic as well as the gel. Here we have laser removal on a Fitzpatrick 6. So a huge market for laser hair removal. Remember, this is kind of towards the bottom of the pyramid. You want to cast a bigger net. You can treat pretty much the entire body. Obviously, you need six treatments. A lot of people think that laser hair removal is permanent. It's definitely not permanent. So you do need for patients to come back once a year or twice a year afterwards. So how does it look in terms of return investments, right? So that's the biggest, most important thing when we do these kind of secondary kind of careers. So this is just a rough estimate of how an average, for example, what I would charge for someone. It varies a little bit in terms of which body part you're doing. So if, for example, if you're doing 4 treatments per day, on average is about $150 per treatment, $12,000 per month, multiplied by 12. you about 104,000 per year, right? So that's just your laser hair removal, right? And so, depending where you are, that might be higher or less, or you're busier and whatnot as well. Vascular treatments, these are my photos here. So Venus Lakes, one shot on the left side. So it's very good, it's a long pulse, very comfortable for the patient for vascular treatment. You see on the nose as well. And the spot size are actually very large and very tiny, so you can cover a lot of space very quickly. Treating a bit of rosacea with laser genesis. And laser genesis is one of those techniques that you can do actually all year long, right? So some of the problems with some of our lasers that, it's very seasonal. You don't want to do in like the summer or like when there's like high sun out, just because of new skin, right? And so with the laser genesis, because it's penetrating deeper, you actually can use it year long as well. So with the laser genesis, that's the Zio signature procedure for the ND YAG. So it stimulates new collagen. And this is something that we do initially. A lot of these procedures we do like 3 to 4 in a row, every 4 to 6 weeks apart, and then they would do once or twice a year to maintain it. These are some of my pictures here. So here we're using laser genesis for treating acne and a bit of rosacea here. So with this is about 4 to 6, probably 4 treatments here to get these type of results. So it treats not only the texture, the pore size, the erythema that we get with the acne, inflammation, scars, and overall skin health, poikiloderma as well. Pigments, melasma, really difficult to treat. Now, these are not my pictures. Now, these are obviously one of the best, 1064 YAG melasma treatments. It's really tough to treat melasma, first of all, so don't expect to treat melasma really well with the YAG. You need kind of a more specific type of laser. More typically, the pico lasers will allow you to treat melasma more effectively. Now, we can only treat melasma, not cure melasma. But with this, when you treat pigments, it does take a little longer, but you can get the job done. So the laser genesis, the 1064, can be used in all skin type and skin colors. Treats redness, texture, tone. It typically leaves 5 to 10 treatments, and maintenance as needed. All right. So with laser genesis, for example, and it depends on where you're training. Some of the prices can be about $350 per treatment. So you can imagine if you do that 3 times per day, those are your numbers. So really, these devices, really by the end of the year, will pay for themselves, right? So the Limelight, which is the IPL system, this is definitely a must-have for any aesthetic practices. Just a little be careful when you use any IPL system. There's only a certain Fitzpatrick you should go to as well. So the nice thing with all Cutera devices is that it's foolproof. It's very safe. There's not a lot of settings that you need to do. It's all programmed for safety. For example, if you want to boost energy beyond a certain range, they won't let you, because they know that it's going to cause more injury. So there's 3 programs in it, as I mentioned, and it's kind of preset for you in terms of the range. So these are some of the achievements you can get with an IPL system. So obviously she's a Fitzpatrick 1, possibly 2, so you can really crank the energy and get those kind of redness and browns as well. Décolleté area, forgotten most of the time, very easily treated. And you can achieve that with 1 treatment, depending how aggressive you are, right? So, Limelight. So a global rejuvenation, revitalization of the epidermis here. So just remember that when we use IPL systems, they're typically Fitzpatrick 1 to 3. You can sometimes do a 4. You just got to be careful of your energy. Typically about 3 to 4 treatments, 4 to 6 weeks apart. And you can pretty much do the face and neck. But also the other body parts as well. So sometimes we can do the hands. So people forget about the hands, right? So we do the hands here. These are all my pictures here. So treating for a bit of rosacea as well. So in terms of combination therapy here, this is where, as you do it more, you learn. And so the IPL systems, Limelight or any IPL system, is very superficial, right? So you want to penetrate deeper. Rosacea is a kind of a deeper type of erythema. So you can combine that with the 1064, which is a long pulse, and you actually have more effectiveness with respect to treating the redness, and it actually stays down longer as well, so before it comes back. So examples of what we would typically charge, and typically we would sell in packages, and that's the best way to sell these devices. So when you get a Cutera device, it comes with a key kind of device manager who helps you to integrate into your practice. They have a lot of internal marketing tools for you too as well, and they walk you through all the process and how the training, everything too as well. All right. Any questions about the Zeo? Go ahead. Yeah, so any hyperpigmentation like PIH, you can definitely treat with 1064, right? With hypopigmentations, really over time, they will come back. The melanin will come back over time. There are injectables you can do to give pigment, but you can treat hyperpigmentation with 1064 like PIH. Yeah, really, because when you get hypo, right, you're really destroying the melanocytes, and so you're not gonna really treat that. Because there is some tinting products they can use for that to kind of mask it. But a lot of times when you do have, a thermal injury, it can be hypopigmentation afterwards. But with time, like 1 year, 2 years, actually some of the pigments do come back. Right.
Sorry, quick question.
Yes.
Holistic.
So, I mean, for me, I use PRP a lot with my procedures, right? And so, basically, once I do the triple, then I do actually with the mesogun, and also I do fillers with PRP on top of that too as well. Yeah.
No, but the word holistic doesn't.
Yeah, I get your semantics. Yeah. Okay. So, moving up on the pyramid here, so the rate of frequency, microneedling. So we're moving higher in terms of the aesthetic pyramid. And the beauty of the radial frequency, this is one part of the hottest devices or procedures done in the last few years, is the microneedling with radial frequency. And the beauty of it is that you can treat pretty much all body parts as well, right? And also every skin color, Fitzpatrick color, with microneedling. So microneedling, as I mentioned, it's one of the hottest, and it's just a significant growth, about 7% compounded over last several years, more than 1 million procedures being done. Lots of microneedling RF machines out there. So I'm just gonna highlight some of the nice points with respect to the secrets. So the places you can treat, very hard sometimes to treat perioral areas, the smoker's line, nasolabial folds, the crow's feet as well, the neck region, above the knee, cellulite, and striae as well. So you can treat any part of the body with these secrets. So you're opening up a lot more indications. With the secret, it comes with 2 different heads. So a large 64 pin followed by a 25 pin. Typically the 64 pin is done for body, and the 25 pin is for face, but you can do it any way you like. If you're experienced, sometimes we do a 64 pin on the face as well. It is a little more painful because obviously there's a lot more pins, but you get the job done much quicker. There is a difference with respect to the pins themselves, and so what Cutera has done is that it made it really safe to do on Fitzpatrick 4, 5, and 6. So the 64 pin comes with a semi-insulated tip versus the 25 pin comes with non-insulated. So you're using the non-insulated 25 pin for people with Fitzpatrick 1 to 3, possibly 4. But for darker skin colors, you're using the semi-insulated pins. With respect to delivered energy, you can range from 0 to 100%, obviously. And that's the nice thing about the Kutera, allows you to gauge that, and also the depth that you're going to as well. So it goes from 5 millimeters to 3.5 millimeters. So typically, you can actually do different depths to get a full thickness of the dermis. This is their user interface. It's very intuitive. So if you delegate the device, you can actually program for certain technicians as well and allow them to change within a certain frequency. One of the nice things about the Kutera device is, with any microneedling RF, there's quite a bit of discomfort despite using, topical anesthetics. One of the tricks to help mitigate that is actually to use a lower intensity, but increase the duration of the pulse as well. So you're delivering more, so less energy a longer time, and you can achieve similar effects. For those that want the tech specs here, so these are bipolar devices, so you don't need a ground. Max power is about 25 watts. So the RF intensity from 0 to 100%. Typically, you're doing about 30 to 60%. It has a different repetition rate, just with respect to one's technique. The needles are gold-plated, so that's a nice thing. The needles are, when you do with microneedling, sometimes the needles can get very sticky. When it's gold-plated, less chance for that, less injury to the epidermis as well. And the depth, as I mentioned, from 0.5 to 3.5 millimeters, which is quite deep. In terms of the mechanism of action, as the tip makes contact there, the needle is deployed, energy is delivered, and depending on the type of needle you're using, the energy can be delivered through the entirety of the needle versus about 80% towards the tip. And it causes injury and then collagen rejuvenation afterwards, so remodeling. Just a depiction of the depth. So depending on your body, depending which part of the body you're using. So if you're doing kind of the belly, the above the legs or knees and stuff like that, you definitely want a 64 pin. You can go 3.5 millimeter. And you can actually work your way back. Right? So we do not just 2 passes. Sometimes we do 4 or 5 passes as well, right, at different depths. Obviously, there's more swelling to go along with that, but you're assuring kind of full treatment. And it's important to understand kind of your own technology because, even though microneedling with the CRF here, we say you can treat Fitzpatrick 1 to 6, it's your pins and the choice of pin the head that you use is going to be important. So with the 25 pin, it only comes with a non-insulated tip, and so the energy is delivered from the tip predominantly all the way to the base of the needle, and so you get actually a bit of tone treatment as well, so some of the pigments will be improved. A lot of times, microneedling is just more for rejuvenation, but it depends on the pin that you use. So with the semi-insulated, the energy is delivered predominantly at the tip of 80%, and so that's why you want to do multi-levels. Just a radiograph of the type of injury. The type of necrosis that comes with RF is very isolated. It's very similar to CO2. And if you use the CO2, your downtime can be 4 weeks, 5 weeks as well before you're back to normal. And so with the microneedling RF or radar frequency in general, that's why it's used so much, because the downtime is about 1 to 2 days, right? And it has a large area of coagulation, so it reduces a lot of the injury. Just a difference between some of the mechanism. And so when the needle comes in, they're going to feel a bit of discomfort. And so how smooth it goes into the epidermis and dermis, that's going to help determine the discomfort as well, right? And so it's a very smooth mechanism with the Secret RF. And as I said, these pins are gold plated, so it actually punctures and it doesn't create a lot of friction, especially if you're doing multiple passes as well. So these are some of the results you can achieve. These are all my results here. So doing the crow's feet. So there's a lot of techniques in where you place it and how many passes and what angles you do in terms of your intensity of energy and how long you deliver it for. So you can see the hooding improved on the left eye there, just below the underneath the eye as well. The marionettes. And that's actually one treatment. So there's a lot of remodeling that can happen with respect to using microneedling RF. The neck area. This is one treatment as well. Acne. More acne scars. Cellulite. So this is where you would do a lot more energy. They could tolerate more in the leg, a lot deeper, longer intensity as well. This is actually one treatment. Not typical for poikiloderma. This is, typically we wouldn't see these type of results. So these are kind of, anomaly results for this. Striae, very difficult to treat. Sometimes I combine this with a CO2 laser towards the end. Acne scars, ice picks. Like as I mentioned, sometimes you do get the tone improvement with the migraine, and that will only come with the non-insulated tips. So really, before when we used to do a lot of fillers, I would say, well, this is how many fillers you need. But, if they want multiple places, what I typically do is actually recommend doing the Secret first. And then because, after 3 syringes, it can almost pay for about 3 sessions. So what they'll find is that their texture and tone improves a lot better, and the amount of fillers required are actually a little less in a sense. So that's how I combined it. I also combined it with a lot of PRP too as well. So I'm a big fan of PRP. People combine it with body contouring to help skin tightening. And you can combine it with laser genesis. And so a lot of times some people do a micro peel with CO2 after the end, and actually helps with the healing too as well, and does resurfaces the epidermis. So in terms of marketing, when you get a Cutera device, you get account key managers to help you integrate into your practice, training, and do digital social media marketing as well. Any questions about the Secret RF? Yeah. Yeah, so, it's just a different technology. So I'm not familiar with the skin pen itself. I can tell you that there's a lot more things you can tweak in terms of making precise depth, delivery of energy as well. I do have experience with InMode, like another brand. You see the tip heads are totally different in terms of the size, the needle itself. And so if you've ever done microneedling on yourself, it's quite painful. That's the bottom line, right? And so for me, I don't have NOS in my office. So the way I get around that is I actually lower their energy and give almost a full second of energy, right? And so, and that's where you have the most discomfort, really, right? And so that's the difference. So I don't know if the skin pen is an RF as well. I don't think it's an RF, right? So it's just really pure microneedling. This is microneedling with radio frequency, which is a totally different beast in itself. You get way more rejuvenation and remodeling as well. So skin pens, I do see that the people use it a lot with PRP. They rub it on too as well. So yeah, no problem. So microneedling itself is just basically trauma, right? That creates rejuvenation, right? So it's how the body heals. But what you're doing is that you're basically taking the trauma times 10, right? So more trauma, more injury, more rejuvenation. So that's when you get the new collagen building as well, right? So that's the major difference. And so you contrast it with the therapies that cause rejuvenation. And so the gold standard before is really the CO2 laser, right? So CO2 laser was big in the 80s, 90s, and then it really kind of in the 2000s kind of decreased because of the downtime and the technology has advanced so much. But now CO2 is coming back into the forefront as well because in terms of their algorithm and stuff like that, that's less injury. So this is just another form of remodeling, but you can think about with the CO2 laser, for example, you can't treat Fitzpatrick 4, right? But here you can treat any Fitzpatrick, right? So 126. So it's basically your population, your cohort you're treating is much larger. We do use numbing creams for sure. Yeah, you definitely want to use numbing cream. So I use lidocaine, prilocaine, and benzocaine. Yeah. So I can't remember. I know it's 7% lidocaine. I can give you kind of what I use for sure. Yeah. Yeah. And it's about 45-minute numbing, right? I mean, that's how much you numb for, right? So, and we even take it off sections at a time just to maintain that numbing. So it is a discomfort. So that's why devices you choose should allow you to make all these adjustments. Any other questions? Okay, thank you.